right, let's take a look now, of course, at what possibly the president could be saying this evening about 1936 at the moment, awaiting, of course, President Cyril Ramaphosa's address to the nation this evening. Lots of anticipation about what he will possibly say. So political analyst Sandile Swana, as well as economic analyst Sanusha Naidu, join me now. Lots of speculation at this particular point. I will start with you, Sanusha. I think a lot of concern at this particular point about what the president will say and what this will mean for the country's already ailing economy. What would you expect the president to tell us tonight?
Good evening, Griselda, and good evening to my colleague Sandile and to the viewers. Just to clarify, I'm not an economic expert, but what I can say is more from a political economy perspective. I think it's going to be a question of whether he goes really tough and how that will impact on all the speculation we've seen in the run-up in the last 24 hours around the closing of beaches, the impact on tourism. We even saw today that the alcohol industry were appealing to their patrons, to their customer base, but inadvertently and inherently appealing to the president as well, not to create any more restrictions around the sale of alcohol. And of course, there'll be questions around the sale of cigarettes as well. So I think the question, the real challenge here is what the president sees as those non-negotiable areas in the economy, and they're none. If you want to be really, really blunt about it, there are really none of those non-negotiables that exist in the economy that you can afford to say, in this sector of the economy, I can make these kinds of very stringent regulations and set down some kinds of restrictions. Because at this point in time, the economy is in an interdependent state. Everything is interdependent. People's livelihoods are independent, and we are about, at least at this point in time, we are not that far off from Christmas, and it's looking, and we always knew it was going to be a bleak festive season. People have been in lockdown mode for more than 8 months. They now need to go out. And I think the problem here is, how do people take responsibility for their own kind of engagements in public spaces? I think for a long time now, the appeal for people to be able to take on the responsibility, be responsible for your own kind of preventative measures, and don't risk your life, but don't risk other people's lives. And I think that in itself needs a social behavior change. It needs a mind change, because I think you can enjoy the beach, but you can enjoy it responsibly.
Mr. Swana, let me bring you in there. The president clearly has got quite a delicate balance to strike, that of saving lives and also making sure that the economy continues to run. Speculation about, for example, some restrictions on the beaches. We'll hear about that very shortly. But this has massive, massive impact for I would say business as well, who are already struggling at this particular point. And government needs to be seen to be doing something in the interest of saving lives and also ensuring that the economy, which is already ailing, doesn't plummet any further.
Yes, I think that by now most of us are familiar with the impact of coronavirus. We have to be careful here. The issue that the president is confronted with is also to be seen internationally to be bringing this, because it is an international pandemic, so he needs to be seen to be doing something. But at the same time, we must remember that in South Africa, this virus has got a very high survival rate and a very low kill rate, if we were to put it that way. So if we are looking at it statistically, the saving of lives is always necessary and prudent. But if you look at this virus amongst other killer factors, I mean, we are very far. Even if the death rate were to increase 20 times, we're still not 1% of the population dead. So from that point of view, it's there. Now, the issue here at the same time is exactly what Sanusha is talking about, that when they said they want to flatten the curve by causing these restrictions to be done by government as opposed by the individuals, the families, and the community leaders, where people control their own destiny. That social transformation or socialization of people, orientating people to a new way of life, should have happened simultaneously with the technical interventions, the legislative intervention. The mentality of people in 8 months has not changed. Now, even if we introduce restrictions now, the only thing that will really save people is if they adopt these changes. There is no vaccine that's going to change them in the near term. It's nowhere near. They're only going to get a vaccine for 10% of the people next year when it comes, and it might take several years even for that. So the issue of social science, the social scientists have got to intervene now and provide proper solution for changing the behavior of South Africans.
I want to talk a bit about the political aspect of this, Mr. Swana. How does the president then manage to put these restrictions in place to save lives and also at the same time manage what I was asking my colleague Sandile Swana about earlier on, a political fallout from opposition parties who are unhappy with the manner in which some of them, how the president has handled this outbreak?
I don't think the president is unwise as to, for instance, the fallout. The main opposition party in South Africa is the DA, which controls the Western Cape and is the main opposition in the country. From an economic point of view, I think even in this interview, it's already agreed that the idea of a total lockdown of sectors, economic sectors, is over. So the fallout will be very, very limited. I think Ramaphosa is going to come with ways of saying, for instance, the liquor industry. I was impressed with the liquor industry. It's just that their thinking is not deep enough to say, we can regulate these things. We can control what happens in our sector ourselves. So he might come even with regulations that say, guys, this is what I want you to do. I don't want this burden to be in my hands. It must be with you as industry leaders, as how health and safety has always been there. You have the EFF. The EFF has wanted probably a perpetual lockdown, which is impossible. So we can't even consider that. So the main protagonists in this battle would be the DA and the ANC. And I don't think Ramaphosa is the type of president who's going to be too keen to close down economic sectors. He has been losing jobs even before COVID-19 came along. He was losing jobs when he joined the Zuma state in 2012. They started losing jobs together, and he's been losing jobs even faster when he took over himself. So I don't think he's in the mood of losing jobs any further than this.
Ms. Naidu, would you agree with that? I think general sentiment being shared that South Africa cannot afford, a harder lockdown because of, the ramifications of what we've all seen now. Would you agree with more of an approach where certain sectors where there seems to be problems, like during the previous address that the president, when he addressed the nation, it was very targeted at specific areas that seem to have been problematic?
Yeah, I think in terms of what the responsibility of the state is and what the role of the state is must be very, very clear. When you think about business and you think, let's just take the example of NEDLAC. NEDLAC is an important structure in the context of the South African economy, in the context of the relationship between state and business. And it is in there that you can actually start where your discussions with business can be much more negotiated around what role business can play in the kinds of regulations that they can put forward. I think, as my colleague said, looking at the alcohol industry and, of course, realizing that any kind of stringent just going into a no bars lockdown where you go into a complete lockdown and everybody's movement is restricted, jobs are lost, etc. It's not something that the president or the country can afford.
So
remember, we go into a local government election.
Apologies for interjecting there. Then Correct. What shape should this tightening up take, if I may?
Okay, so let me just say, we're only focusing on the alcohol industry. We're focusing on those industries, or particularly the alcohol industry, and what we also consider as the tobacco industry, where we say that this causes undue pressure and creates undue pressure on the public health sector, and more importantly, broadly the health sector in the country, because it's so constrained. But I think there's also the question of asking retail companies like your supermarkets, reconsider the way you construct the architecture and the floor planning of your store. I walk into a retail supermarket. I don't see social distancing because they're crowding the aisles. Everywhere you walk, there is so much of things with specials, buy 5 for this, 6 for that. I mean, they need to start rethinking the kind of spatial organization of stores. And this is where you can start helping in terms of creating that social distancing. I don't see the monitoring happening in some supermarkets. I know that we have to start being vigilant in terms of taking onus and responsibility. But I think also certain sectors where it's a festive season, people are going to be going in, like, for example, going to do their shopping. Be more vigilant about how you actually spatially organize your stores. And I think that's what we haven't seen. The malls, for example, they can be spatially reorganized as well. You don't have to have every store that's so linked to each other. You can create these. We have to get out of this culture of being only inside in malls. And I think we're only focusing on those sectors where we think that's the causal link, or that's the cause or the root cause of the challenge. I think in other sectors as well, it may not be but directly related, but they do create the kinds of tensions, the kinds of issues that the retail, that the business sector can actually call on their associations and tell them, listen, you can start monitoring in your stores how to start creating a kind of effective engagement around social behavior. I agree that social scientists are important. I agree that civil society will play a critical role in communities as well as community-based organizations. I agree that all of it is important, but it all has to be a collective effort.
Mr. Swana, perhaps I could bring you in there then. Ms. Naidu speaks about, for example, the business sector taking responsibility. Why is it then that even at this point, at last, I don't think I've seen any of that happen thus far, where you have, for example, these establishments being fined for behaviors where they don't take responsibility for what is happening within their stores? Surely industry like business should take responsibility by perhaps even giving a slap on the wrist of these establishments that are simply not adhering.
If you were to compare us to, for instance, the nations of Southeast Asia like Taiwan, and then further down towards New Zealand, which have succeeded in actually containing coronavirus, you will see that over the years, when this SARS and other bird flus and others that have swine flus and others that happened before, they started to put in systems and how to get their societies to be more collaborative. In South Africa, for instance, the issue of health and safety, the people that I know that have played a role over the decades, if not the past 100 and whatever years, was the mining industry. Even now, during coronavirus, they came forward with health and safety plans and suggestions and improvements and what have you. The other sectors, even now, as you hear from my colleague Sanusha here, they are very casual. They are not used to this. And there is no effort. And this should not be about penalties as such. It is about changing the culture of South Africa to be more health and safety conscious. And to be more collaborative. And the unions, even Nehau, I was listening to Nehau talking about this thing. It's only now that Nehau is focusing on saying infrastructure must be like this in the hospitals, health and safety must be up to this standard. But they've been there for so many decades without attending to those issues. Now their own members are exposed to great dangers and some are actually dying. But those are issues that should be part of the day-to-day operations of the entire health sector, with the unions leading that in every sector, not just the health sector. So to me, it's a cultural change. And leadership, by the way, dictates culture. Leadership dictates values. And that has not happened so far, even in the past 8 months. And
are you saying that leadership that the president and even others should have provided simply wasn't there?
No, the leadership wasn't there. I mean, there's no doubt about that. Otherwise, we wouldn't be here. You see, one of the tests of leadership, when you say I'm leading people to the east and people go to the west, it means you are not leading those people. That's why now many people are thinking about the scope and donor approach. When you force people with scope and donor, you beat up people, you fine people, you compel people. I mean, when you listen to the case study of Taiwan and you listen to what they've done, there was no scope and donor at all there. It was 100% social cooperation, and they succeeded marvelously. with it. So there is no leadership. There's no leadership that captures the imagination, that captures the hearts and minds of the people of South Africa. South Africa is wild. It's just wild.
You would agree with that, Ms. Naidu? Lack of leadership? South Africans are wild, says Mr. Swana?
I would take a little bit more of a tempered approach. I would say that I think leadership is important, and I think that Mr. Swana is completely right. I think there's a sense of what leadership means as a collective responsibility in Asia, in the Asia region. There are those areas of Asia where you have difficulty in terms of trying to say, well, this is where you have to actually start having the kinds of impact around collective responsibility. But I think the countries that is mentioned by Mr. Swana are very interesting countries from a cultural perspective, from an identity perspective, from a political and leadership perspective, and in terms of how those conditions all kind of merge together. I think what's important as well is that the idea of one's individual civil liberties versus the social compact or the social contract and the collective responsibility, it kind of gets lost in South Africa. I think for us in South Africa, the individual civil liberty is much more important. And it's emphasized a lot in terms of the Constitution, in terms of the Bill of Rights. It becomes almost an important dynamic of one's living space, of one's professional space, of one's personal space, of how one actually identifies their identity in South Africa. And I think in the context of East Asia, we understand that there are cultural differences, and there are and the context of norms and principles are interesting in terms of the role that the state plays and how that the leadership then takes. I would say permeates down to society and the role that society considers, or people in society considers, as their relationship to the state. I think we still have to realize, and this is not just South Africa, I think that where we have these similar tensions between state and citizen, between what the collective and what the individual is in societies around the world, I think we still have to understand that these kinds of tensions that exist in the world today or in South Africa today is born out of the fact that we're also dealing with some serious socio-economic challenges, structural conditions, inequalities, intergenerational inequalities, etc., which have permeated and have just got exacerbated over time.
Yeah.
And so it becomes a powder keg of sorts.
Let me bring you in there, Mr. Swan. I guess then that even beyond, I guess, what happens today or what happens in the next few months or even 2 years, South Africa would obviously need to address some of those structural challenges that Ms. Naidu speaks about to address the greater problem, it seems, of where we find ourselves as a nation.
Well, there's no question about it. And you must remember that in the period preceding the last election, Thabo Mbeki made the point, he raised the question that the ANC does not have an economic development plan. There's no plan, no plan. The same issue has been raised repeatedly up until today by Padile Hutla, the former statistician general. And there is no evidence plan to create socio-economic transformation in South Africa. It does not exist as we speak today. So we still have to go through the labors of formulating a plan rather than writing pamphlets. I mean, some of the things that were prepared by Treasury, they were qualified as an assemblage of essays, disjointed essays that have just been packaged together, and that was called an economic plan of South Africa. So even that work needs to be done, the construction of capacity to plan to run the state with competent professionals who understand what must be done to address the educational system, vocational educational system, reindustrialization of South Africa, the introduction of ICT, and the fourth industrial revolution, township economy. All of those things need very deep thinking by serious, well-trained and experienced professionals. And that work has not yet started in South Africa, but it must start.
If that does not happen, let me bring you in, Ms. Naidu. If that does not happen, I guess one of the things that was exposed during the outbreak of this pandemic, if in the South African context, is possibly how ill-prepared the health system was to deal with something of this magnitude at this scale?
Indeed. I mean, I think we knew this was coming. We just didn't know when. And of course, coming to the end of 2020, we got 2020 vision. So I think what's very important for us to bear in mind is how much neglect, lack of investment in infrastructure development, the rent-seeking behavior of political and economic elites, using the state as a kind of personal ATM. I mean, all of these things culminated into the fact that years of not putting the money into the right spaces, upgrading the facilities, ensuring that the infrastructure was, if it was to be tested, that it had some durability. All of this is now showing us that what we are experiencing now is what some academics in the social sciences particularly call the kind of new security threats. They're not these traditional security threats of what the state is, but it's the internal dynamic of urban sprawl, which urbanization takes place where you don't know where the formal and the informal start or begin. You've got these spatial inequalities. You've got these incredible challenges around the lack of housing, the lack of sanitation, the lack of water. And these become important spaces where the precariat, the people who are marginalized, who are living on the periphery of the urban space, they become highly mobilized and become volatile. And so you have this urban security threat to the state. And that's born out of the fact that these resources that are supposed to go to keeping the township economy afloat, to allowing people to integrate into the formal economy, to structure all of that, becomes the serious intra-security threat of the state.
Mr. Swana, we're going to run out of time very shortly, and I'd like to apologize if I'm going to cut you off. If the president indeed does walk in, we'll probably need to cut to that. But I guess things cannot be, you can't just pay lip service to issues such as corruption, which also during the outbreak of COVID-19 in South Africa had shown, I guess, the blatant, unapologetic nature, I guess, of corruption and those who have carried it out, irrespective of where we found ourselves in as a country with the global pandemic, which is ravaging every single nation on this planet.
Yes, I think the biggest problem with this COVID-19 corruption, which has also happened in Britain, by the way, as well. But let's talk about South Africa. In South Africa, the Auditor General has pinpointed over many years the high-risk areas where money such as the PPE funds could be easily stolen, where controls are weak, municipalities, provincial departments that are weak. So which means that you could have identified those municipalities and those entities that are getting clean audits, that are running a good show, and given them a different financial treatment to those that are clearly high risk. Secondly, there are individuals that are well known in South Africa from moving from municipality to municipality, province to province, leaving one scandal behind, going to start a new one. So even the people, the individuals, once you know that
Swana, I really have to apologize. I did give you somewhat of a warning there that unfortunately we're going to have to wrap this one up. Thank you very much indeed to both of you for joining us here on the program. We're expecting the president any minute now to address the nation. Exactly 8 o'clock was the time that we were expecting. Sandile Swana, of course, and Sanusha Naidu joining us there on what to possibly expect from the president. We'll go live to the Union buildings very shortly, where we expect the president to address the nation. Very quickly, let's take a look at some of the tweets that have come